what's your secret? You got the kind of vibe that leaves one speechless. It could be model multitasking genius. Yeah, you got it all.
Welcome to Breakthrough Conversations with Rhoda and Company, where we explore stories, insights, and defining moments that shape leaders and change makers. And I am so excited. Today's guest brings a rare and powerful dual perspective, one that spans both the boardroom and the bedside. Dana E. Sherwin is a healthcare consultant and speaker with more than 35 years of experience across hospitals, managed care, and some of the largest healthcare consulting firms in the country. She's a fellow of the American College of Healthcare Executives, a trusted advisor and peer reviewer for lead healthcare journals, and a nationally respected voice in patient-physician communication. But Dana's expertise, it doesn't just stop with her credentials. She's also a 6.5-year survivor of a stem cell transplant for a blood cancer disorder, an experience that profoundly reshaped how she views healthcare, communication, and the role of patients in their own care. So through her work and her platform, The Thinking Patient, Dana challenges us to rethink the patient experience, not as passive recipients of care, but as informed, empowered partners in the healing process. Welcome, Dana. Thank you so much.
Thank you, Rhoda. Appreciate it. It's great to be here. Thank you for that beautiful introduction.
Yeah, you have such a powerful, beautiful testimony, and I'm so excited to have the opportunity to speak with you. You know, you spent a decade inside healthcare organizations as an executive, a consultant, and an advisor. From that vantage point, where do healthcare systems most often fall short in truly understanding the patient experience?
Yeah, so most people know that there's just so much pressure on healthcare, the supply of healthcare and the demand for healthcare. And these pressures are enormous, and they result in making it difficult for people to find care and to get care when needed. Whether you have insurance coverage or not, there's a limited supply of primary care physicians, of specialists, of emergency rooms, and the ability to pull people through in a sort of a careful kind of process. When people actually come to the systems, when possibly they've already delayed getting care, they might have had some symptoms and they said, you know, it's just too challenging to seek care right now, and so they delay getting care. So all of that, when the patient ends up meeting the system, is really creates this just incredible tension. So I think that's where the main challenge happens for both people we're all patients, and the healthcare system. And I think that's one of the biggest challenges, because when you have it that way, there's not the time and the thought and the resources to help people be better patients in terms of understanding how to use the system, understanding how to communicate better with doctors, and understanding really how to have agency in the system, which many people will use the system once a year. Some people have to use the system once a month or more. People with chronic illnesses need sort of a continual access to healthcare resources. And just this pressure between the supply and demand results in very little time for either the system or other aspects of our environment, whether it's the work environment, to teach people how to best use the healthcare system.
And the way you describe it, it truly is a system. I worked in healthcare for 25 years, and I struggled with understanding how to navigate the system. And as a patient, I had an experience where it was near-death experience, where I was having an allergic reaction in my kidneys to penicillin, and I was severely sick, almost toxic sick by the time I got seen. But it wasn't because I wasn't going, though. So that's the interesting part to your point. And there's like no orientation to it. There's like no proactive opportunity for us to understand the system before we have to leverage the system. So to your point, there's a lot that when you're already presenting as a sick person and you're trying to understand the system, and then you have family and loved ones, they don't understand the system either. So you're spot on. And it's interesting that the concept of patient experience hasn't been around that long either. So thank you for that. So your platform, The Thinking Patient, centers on patient physician communication. What does thinking patient mean, and why is that mindset so critical in today's healthcare environment?
Yes, that's a great question. I think that so the thinking patient has this recognition that patients have a very important role to play in their own healthcare. But everybody, I don't know anybody who feels calm about either being sick or the prospect of being sick. So there's
Right.
just so much. It's just complicated by, emotion, by fear, by frustration. Maybe family members, or you've had prior experiences that were not good, were not comfortable. You didn't get the results that you want. You might have anxiety. The introduction of a disease or an illness comes with so much anxiety
Yes.
because you want to be cured, you want it to go away, you want like to move on with your life and be healthy. So there is this combination of things that happen. So to be a role, to play that role as a patient, you need to use, cognitive skills, you need to develop abilities, you need to understand how the system works. It's a very thinking oriented, cognitive oriented thing, which can coexist with all the other, with the fear, anxiety, frustration, stress, all that. So have it coexist. It will end up lessening a person who really understands what their role to play is in seeking healthcare. I'm not saying that the stress will disappear, but it will get less because you have this pathway to go through. So that's what the platform is about. The mindset is this mindset, like this growth mindset that whatever I could put my mind to, I will get better. That over time, doing small things, developing better habits, developing small skills, taking small steps to take care of myself over the long term will be very beneficial. And, so I call the sort of this continual process of the mindset and the application of all these skills, engagement, patient engagement. Many of us have heard that term, patient engagement. It's really the umbrella term for all the things. You need to partner with your doctors, you need to participate in shared decision making, you need to have informed consent, all these words. Well, this is all under the umbrella of patient engagement. And what do you need to do to be engaged? And that's really what the Thinking Patient platform is all about.
It's so needed. And thank you for, this to me is mission work. Thank you for this. And on the heels of what you had gone through in your own personal experience, you took that and turned it for multiple people to benefit from. And to your point, those things, when disease introduces itself, it does breed a lot of anxiety and fear. But to your point, that can coexist with your cognitive ability. That doesn't mean that you have to be passive in the process. So thank you. So from your experience, what are the most common communication breakdowns between providers and patients, and what impact do these breakdowns have on outcomes?
So when patients come to an appointment with a physician unprepared, one, not knowing how a physician learns and executes on a medical interview, sort of not knowing all that and coming without being prepared to that, it makes it very difficult for the doctor then to do what the doctor needs to do in terms of interviewing you and asking you questions about your health and your experiences and what happened before and what are you worried about and what are your preferences, and sort of that dialogue between the patient and the physician. So everybody knows that these appointments are very time limited. Some appointments 15, 20 minutes. Some appointments, I've been told, are even shorter. So with that pressure, the pressure on both the patient and the doctor, if the patient isn't prepared coming in to the appointment with what they want to accomplish, like what are my priorities? What do I want to get out of this? What questions do I want answered? What research that I might have done that I want the doctor's point of view? Because it really, the physician appointment is really a precious resource. You have 15, 20 minutes to accomplish something, to set in motion something that's going to be very beneficial to patients. And research studies have shown that people who are engaged in their care and actively participate in that physician appointment will have better health outcomes.
That's amazing. That is so true. Key point to our listeners is come prepared. We have a lot of knowledge at our fingertips with AI, with the internet, with social media. Come prepared, do your research, have your questions ready. Because to your point, Dana, is that we have limited time. And when I remember working for physician practice, and the patients will be all in the waiting room, and then you as a patient could be in your room waiting 30, 35, 40 minutes before the doctor even enters because he or she is running behind. And to your point, lots of pressure everywhere. So being prepared is key. Great point. So you've lived on both sides of the healthcare system. Can you take us back to the moment when you became the patient and how that experience changed you and your perspective?
Yes. Sort of, it was a process for me, but I did have symptoms that I ignored. And I was in the healthcare system. I had many different jobs throughout my career. I knew a lot about how the healthcare system works. And I still ignored and didn't do the things that I needed to do. So I had a symptom that just wouldn't go away. And I went to a doctor and the doctor said, oh, you should really see this kind of specialist. I went to that specialist. The specialist said, okay, we're going to take some blood tests and we're going to do a sonogram. I said, well, is it an emergency? He says, no, you'll go for the sonogram. But when I went for the sonogram, I saw the look on the technician's face. I had a blood clot in the portal vein of my liver, and they sent me for a CT scan immediately, or an MRI. I don't remember which, but they were concerned enough to call my gastroenterologist. And he called me and said, do you have a hematologist? And I said, why would I need a hematologist? And he said, please get yourself to the emergency room. So I will never forget that day. It was August 14th, 2003. Because we had a blackout in New York on that day. And that was the day that I entered the emergency room. And it was the only department in the hospital that had backup electricity and air conditioning, because it was a summer day and the power had gone out. And that's why I will always remember that day.
Wow.
And I feel fortunate that I was able to get through that experience, find a hematologist, and be monitored for many years. I was able to live very productively for many years. So I really wasn't that far. I was able to have a job in healthcare, work, normal long hours, and have a pressured career and all of that. And basically it was an evolution of my disease, the natural progression of my disease. And then it turned into a state. Basically, my health crashed and I needed a stem cell transplant. So it was like about 20 years later, I needed a stem cell transplant because there was no other cure. So it wasn't, so as I was saying, it was a sort of this progression of understanding, I have this underlying illness, but I was able to really live mainly a normal life until I wasn't able to do that. And then I realized I need to do whatever I can to stay on this side of life, because I needed to, obviously I found great doctors. I knew I was in good hands. I trusted my medical team. I trusted the hospital that I was at. And during that process, I had to think a lot about what I did wrong and what I did right. So when I started, that process of recovery was also over COVID, and it took me a while to really feel better. And when I started to feel better a few years after my transplant, I started really thinking about, well, what have I learned through this? Both with my experience as a healthcare manager and also an experience as a patient with a chronic illness. What did I learn? And I learned a lot.
Right.
And I felt like, well, I think I did all that I could for myself when I woke up and realized that I needed to take, be more engaged. But I thought, well, shouldn't other people have this information? How come
Right.
nobody shared this information with me? Doctors, hospitals, my employer, my health insurer. Growing up, nobody teaches you how to be an engaged patient.
No, no, that was the point I was making earlier. That is so true. So, as a stem cell transfer survivor, what surprised you most about navigating healthcare as a patient versus what you thought you knew as an executive?
I had to really think very carefully about what was in my control and what was out of my control. I was so used to just having the confidence I could put whatever it is that needed to be fixed in my control. Well, when you're a patient, there's a lot there's things in your control, but there's a lot out of your control.
Right.
So it's very important to trust your medical team, trust your doctors, pick the right doctors for you, and to trust them because they're the ones with the expertise and again, as your role as a patient, to be able to ask those questions. So I had to switch to, stepping back a bit, being more patient, listening more, asking more questions. And so that was a process for me. And one of my doctors had advised me, people who like to take too much charge don't do too well through a stem cell transplant process. You need to relax. You need to trust us. And you need to, yes, you can ask questions, but a lot of the times you just need to step back and let us do, our work and our expertise.
Wow, I'm glad he gave you that advice. On the opposite side of that, many patients, they feel intimidated or overwhelmed or unsure how to speak up. What advice do you give patients who want to advocate for themselves, but they don't know where to start?
Right. So that's where I come back to preparation. But most people need some direction or some structure of how to prepare and what to prepare. So before I get into like some of the key elements for preparing, I want to say, because I learned this in my process too, the more you come prepared and focused to have this partnership with the doctor, I have found, and it turns out the research shows this also, doctors respond very enthusiastically to people who are thoughtful, focused, and are planned and careful with their communication to the doctor to share who they are, to have that voice. And so it's not like fighting or being an advocate because something's going wrong. It's saying, look, I have these questions. I want to understand. I want to participate in my care. So with that, as I say, preparation is so important. So when you are meeting, particularly you're meeting a doctor for the first time, you want the doctor to know who you are and what your experience has been. But again, you don't have an hour to have this conversation with the doctor. So you need to, in a way, write things down, make an outline. What are the most important things you want to let the doctor know about you? What are the most important things you want to let the doctor know about your medical history, what your experience has been? You want to share the doctor, what you've been feeling from, a medical or illness or symptom point of view. And what research has found, and I do this from time to time too, let's say, for example, you've been getting a lot of headaches. Well, a lot of people, and particularly people who have a migraine history, they're very used to journaling. So the doctors like to see, have you been keeping record of, do you get a headache every day? Well, how long does it last? What were you doing when you got that headache? So in a way, monitoring and keeping a journal, whatever it is, whether it's a pain, you have an orthopedic kind of pain, or whether you have a headache kind of pain, or it's something that, you get some twitch or you get some feeling, when you're sharing this with the doctor in a really organized and thoughtful way, then the doctor really responds well. They see that you're very engaged and want to play a big role in helping yourself. So some of the other preparation things as well is that the question asking is such an important part.
Mm-hmm.
So if I'm seeing a new doctor, let's just say I'm seeing a new, I've never been to a dermatologist before.
Right.
I will go, you could Google or AI, what are the key questions I need to ask my dermatologist? I'm seeing them for the first time. So I make sure I'm asking all the questions to be able to take care of my skin health.
Yes.
And you will, I mean, it's really an amazing world today, the information at your fingertips. And when you have an emergency, you're not going to go, Googling but when you have the opportunity to really plan thoughtfully for this short 15-minute appointment with a doctor, you really want to be very prepared.
Yes, yes. And by being prepared and writing all that out and helping them understand the story, they could reach a diagnosis quicker. They can reach a treatment plan quicker. I know this from personal experience. The doctor said, I need for you to tell me a story. When did the symptoms start? What did you notice? And that timeline really helped him expedite and to get to the root cause. So
absolutely.
Great tips.
Said it beautifully. Yes. Yes.
So what responsibility do healthcare leaders and organizations have in creating space for patients to be informed or engaged partners in care?
Well, I mean, that's really why one of the reasons that I developed the platform is that I thought it really wasn't available anywhere else. I think there's a lot available online, and certain large, like academic medical centers, will put like helpful hints for patients or questions. Like you'll have like a cardiac department and online they'll say when you're meeting the doctor for the first time, these are the questions you should ask and this is the information you should bring. So there is a lot of information out there to help people get more organized. But do doctors have time to encourage and guide people to be more engaged in their care? No. Are there nurses or nurse practitioners who generally do that? No. I mean, sometimes if it's a hospital inpatient admission, they will have patient education departments. So typically they have this for maternity. You'll see a lot of patient education when it comes to the maternity department. And maybe cardiac because there's so much aftercare that's needed when you're discharged. But really and it's not really day to day or every day. It's the journey, the health journey that people go on depending on, what their genetics are, their environment, their lifestyle, their diet, whether they exercise, all these things that are really on an outpatient basis. And so my focus is really for outpatient, for your regular outpatient care, because basically what you want to do is do a lot of health prevention and health promotion for yourself because you want to stay out of the emergency rooms. You want to stay out of the hospital, right?
Yes, you definitely do. So, Dana, if healthcare systems truly embrace the principles behind the thinking patient, what would change both culturally and clinically?
I think that if, let's say, a large doctor's practice or faculty practice plans had resources, so staff resources, video resources, even front desk resources that help people prepare for appointments so there's better communication, I think that would be very, very helpful. And again, outcomes are about, lessening pain and having a better quality of life or catching something in time so you don't have more severe medical interventions. All these things are considered better health outcomes and also, more patient satisfaction. So, yeah, I think that healthcare organizations need to have more resources for people to help them understand what it is, what their role is to be in as a patient, as an engaged patient.
Yeah, I noticed that there are more and more roles I'm seeing around patient experience, but there's something to what you're saying about engagement. So patient engagement specialists would be
so they're really two different things.
They are.
And the patient experience is making sure the patient has ease and comfort and awareness going through whatever experience there is. And again, most patient experience programs are on the inpatient basis.
Correct.
right?
is
When
so
you
true.
get to the inpatient, it's because your disease has advanced, your condition has worsened. You need a surgical intervention. You need
Right.
a therapeutic drug intervention on an inpatient basis. So they want to make sure people are comfortable, that they're informed. So yes, but it's really about the processes and the systems around the patient to
Yes.
support the patient's, getting better and feeling good about the experience.
Yes.
Patient engagement is really the active involvement of a person with their medical team on working on what's needed for their health.
Yes. I love the distinction. Thank you so much. Dan, I'm going to ask you 3 rapid fire questions. The first one is one word that best describes what surviving cancer taught you.
Gratitude.
Gratitude.
Gratitude
Yes.
for my medical team, advancements in modern medicine, and gratitude for my own sort of resilience to get through it, and hope.
Yes.
But gratitude's my word.
Yes. One question every patient should feel empowered to ask their doctor.
So that would be the question that the patient is most afraid to ask.
That's deep.
And that, it's different for everybody.
Everybody, depending on your
What's my prognosis? What are the risks? What should I have done differently? What should I do now? If you're afraid to ask the question, that's the question you should
ask. I love that. And a daily practice that keeps you grounded and resilient.
So I would say 2 things. One, they relate to each other, but the first thing is walking. I try to walk every day to get outside, to breathe fresh air, and to put my body in motion. And that's like one of many daily habits I needed to develop that I didn't have before my illness and my health struggles. I didn't have certain habits and daily practices. So whatever, works for the person, but and no matter what illness you have, the habits of healthy living, healthy eating, exercise, and reducing stress, and whatever way you find there are many ways to reduce stress. Those are all really important daily habits.
That's awesome. So, Dana, thank you for sharing both your professional wisdom and your deeply personal journey with us today. I certainly appreciated that. Your story really resonated with me when you and I chatted. And I'm so glad that you've taken this mission on, and then you're helping others on a more broader scale. Your story is very powerful. It's a reminder that expertise and empathy must coexist if we truly want to transform healthcare. And to our listeners, if this conversation resonated with you, I encourage you to explore Dana's work at thethinkingpatient.com, where she continues to challenge how we think about communication, advocacy, engagement, and the patient experience. If you enjoyed today's episode, be sure to subscribe, share it with someone who needs to hear it, and leave a review. It helps these conversations reach more people. Until next time, remember, breakthroughs don't just happen in boardrooms or hospital rooms. They happen when we find our voice. Thank you for listening.
Hey, what's your secret? You got the kind of vibe that leaves me speechless. It could be model multitasking genius. Yeah, you got it all. Hey, what's your story? A kick-ass mom and 40 under 40. A soccer practice in your high heel glory. Yeah, you do it all.